Dr. Reese Thorne, a leading nutritionist at the renowned Northwood Clinic in Springfield, has spent over 2 decades studying the intricate relationship between food preparation methods and nutrient retention. His latest report, published in the Journal of American Health, focuses on one of America's favorite superfoods, broccoli. This unassuming green vegetable, a staple in many health-conscious households, has long been praised for its antioxidant power, cancer-fighting compounds, and impressive nutritional profile. Yet, as Dr. Thorne warns, how you prepare and combine broccoli with other foods can mean the difference between boosting your health or unintentionally diminishing its benefits. In this comprehensive guide, Dr. Thorne breaks down both the harmful combinations to avoid and the beneficial pairings that supercharge broccoli's health-promoting properties, along with scientific explanations, real-life case examples, and practical cooking tips. Part 1. Harmful combinations to avoid. While broccoli is undeniably good for you, it is not indestructible. Certain food pairings and cooking practices can strip away key nutrients or interfere with your body's ability to benefit from them. Dr. Thorne identifies 3 common mistakes that people make, sometimes unknowingly, when preparing broccoli. 1. Broccoli with vinegar or lemon juice. The vitamin C killer mistake. It's common in American kitchens to drizzle vegetables with a splash of vinegar or a squeeze of lemon juice for a zesty punch. Salads, roasted veggie medleys, and steamed broccoli are often dressed this way. But for broccoli, Dr. Thorne says this habit can silently sabotage one of its most valuable nutrients, vitamin C. Why it's a problem? Broccoli is naturally high in vitamin C, an antioxidant essential for supporting the immune system, repairing tissues, and protecting cells from free radical damage. However, vitamin C is acid-sensitive, meaning that when it comes into direct contact with strong acids like vinegar, acetic acid, or lemon juice, citric acid, it begins to break down rapidly. In practical terms, that means your brightly dressed broccoli might look and taste appealing, but it has lost a significant portion of its immune-boosting power. Scientific context. Vitamin C degradation in acidic environments is a well-documented phenomenon. While some fruits, like oranges, naturally contain both vitamin C and acids, their structures are adapted to protect the vitamin until digestion. When you add vinegar or lemon juice externally to broccoli after cooking, you're essentially giving the vitamin C no protective barrier, allowing the acid to break it down on contact. A real-life example. One of Dr. Thorne's patients, Laura, a 46-year-old elementary school teacher, prided herself on her super healthy lunches: steamed broccoli tossed in a lemon vinaigrette. She came to Dr. Thorne frustrated because she was catching colds frequently despite eating plenty of vegetables. After adjusting her preparation method, switching to olive oil and herbs for flavor, her immune resilience noticeably improved over the next winter season. Better alternative: if you enjoy a tangy flavor, Dr. Thorne suggests adding the vinegar or lemon juice just before serving and in smaller amounts, or pairing the acidity with other vegetables in the meal while keeping broccoli's exposure limited. Another approach is to add lemon zest instead of juice. This provides citrus aroma and flavor without the same destructive acid impact. 2. Broccoli with blood thinners, a dangerous vitamin K interaction. The mistake. Broccoli is loaded with vitamin K, a fat-soluble nutrient essential for blood clotting and bone health. For the average person, this is fantastic, but for those taking blood-thinning medications such as warfarin, Coumadin, aspirin, or other anticoagulants, large amounts of broccoli can counteract the medication's purpose. Why it's a problem? Blood thinners are prescribed to reduce the risk of clots, which can cause strokes or heart attacks. Vitamin K promotes clotting. If you suddenly increase your vitamin K intake, it can weaken the effects of your medication, making your blood more likely to clot again. Scientific context. Warfarin works by blocking the recycling of vitamin K in the liver, thereby slowing clot formation. When a patient eats a lot of vitamin K-rich foods like broccoli, spinach, or kale, it essentially provides the body with backup supplies of the vitamin, allowing clotting to proceed more easily despite the medication. Dr. Thorne's advice for patients on anticoagulants. The key is consistency, not total avoidance. It's not about banning broccoli from your plate forever, Dr. Thorne says. It's about keeping your intake steady, so your doctor can calibrate your medication dosage accurately. Practical guideline: he recommends limiting broccoli to about 2 ounces per week, roughly half a cup of chopped, cooked broccoli, and not eating it within 2 hours of taking the medication. This prevents sudden spikes in vitamin K that could disrupt your therapy. A real-life example: Robert, a 68-year-old retired firefighter, came to Dr. Thorne after experiencing a minor stroke. Despite being on warfarin, reviewing his diet, they discovered that Robert had recently joined a cooking club where broccoli casseroles were a weekly staple. After returning to a consistent, limited intake of broccoli, his blood clotting times stabilized. 3. Excessive broccoli for diabetics. Risk of dangerous blood sugar drops. Mistake: broccoli contains sulforaphane, a compound with anti-inflammatory and blood sugar lowering effects. While that sounds ideal for diabetics, too much of a good thing, especially for those on insulin or oral diabetes medications like metformin, can cause blood sugar to drop to low. Why it's a problem: excessive intake of broccoli, combined with glucose-lowering medications, can result in hypoglycemia, a condition where blood sugar falls below safe levels. Symptoms include dizziness, sweating, confusion, blurred vision, and, in severe cases, seizures or loss of consciousness. Scientific context: sulforaphane appears to enhance insulin sensitivity and slow glucose production in the liver. While beneficial in moderation, these effects can amplify the action of diabetes medications, creating a double punch that drives glucose dangerously low. Dr. Thorne's advice: moderation is key. He urges diabetic patients to talk with their healthcare provider before significantly increasing broccoli intake and to monitor blood sugar closely when making dietary changes. A real-life example: Maria, a 59-year-old accountant with type 2 diabetes, read online that broccoli cures blood sugar problems. She began eating 2 large bowls of steamed broccoli daily, while continuing her usual metformin dose. Within days, she experienced episodes of trembling and confusion, classic hypoglycemia symptoms. After scaling back to 1 small serving per day and spacing it away from her medication, her blood sugar returned to safe levels. Part 2: Beneficial combinations to maximize health. Fortunately, broccoli also shines when paired with the right foods. Dr. Thorne identifies 3 powerhouse combinations that amplify its nutritional impact. 1. Broccoli with citrus fruits. Boosting iron absorption. Iron from plant sources, non-heme iron, is notoriously harder for the body to absorb than iron from animal sources, but pairing broccoli with citrus fruits like oranges, grapefruit, or tangerines changes that equation. Why it works: the vitamin C in citrus fruits acts as a natural enhancer, transforming plant-based iron into a form the body can absorb more easily. This combination supports red blood cell production, immune function, and sustained energy levels. Cooking tip: consider a side salad with steamed broccoli, orange segments, and a light olive oil dressing, or toss roasted broccoli with fresh grapefruit slices just before serving. Point 2. Broccoli with onions. A heart and gut health. Onions contain quercetin, a powerful flavonoid that reduces inflammation and helps lower blood pressure. When combined with broccoli's sulforaphane, the 2 compounds work synergistically to protect and cleanse blood vessels. Why it works: this pairing not only supports cardiovascular health, but also feeds beneficial gut bacteria thanks to its prebiotic content, fibers that nourish the microbiome. Cooking tip: lightly sauté chopped onions until fragrant. Then toss in broccoli florets and stir-fry with a splash of olive oil. The gentle heat preserves the bioactive compounds in both vegetables. 3. Broccoli with tomatoes. A prostate cancer defense strategy. Tomatoes are rich in lycopene, a carotenoid linked to reduced prostate cancer risk. Sulforaphane from broccoli complements lycopene's antioxidant effects, creating a potent anti-cancer synergy. Why it works: when broccoli and tomatoes are lightly cooked together with a bit of healthy fat like extra virgin olive oil, lycopene absorption improves dramatically. Cooking tip: try roasting cherry tomatoes and broccoli together, then drizzling them with olive oil before serving. The combination is not only delicious, but also scientifically backed for men's health.